everyone. I'm Mark Plaster, Senior Executive Editor of Emergency Physicians Monthly, and I'm here at ACEP 2019 in Denver, Colorado. And we always like to have new and feature new services and products. And I saw Ring Rescue, and I thought, I knew what these guys were about. They take rings off, and I said, I'll bet you they can't get a ring off my hand. It's been on, that wedding ring has been on for 44 years. So I give you a challenge. Tell us a little bit about the apparatus, invention if we will, and then we'll see if in my case whether I defeat Ring Rescue or not.
All right, good stuff. Well, thanks for the challenge. So I'm Kevin Spencer. I'm an ED doc from Canada, also co-inventor of the device here at the team. And we just launched this product recently. Getting a lot of really good exposure here at ACEP. A lot of rings are coming off today. The way it works is like a little mini blood pressure cuff. It goes over top of the finger, pumped up with air, squeezes the finger, makes the finger smaller. Take the device off 5 minutes later, the finger's slimmer, you get the ring off. So let's give it a try.
Okay, and if it comes off, Rebecca, I'm putting it back on. I promise I'm not going to go out onto town tonight with no wedding band, okay? Here we go. Give it a try.
So the first thing that we want to do with the ring is we want to actually assess the bone to make sure that the bone is not big. So if you have like an arthritic joint, it'll still have to be cut, although our device will still shrink the size of the finger to aid in that cutting process. So what we're going to do with your ring is we're going to push it back to create some space so that we can maximize the pressure over the actual knuckle itself. So we slide this over the finger, make sure that that pressure is over the knuckle. We inflate our gauge, so we want to make sure that we inflate our gauge all the way around back into our blue zone, which is 300 millimeters of mercury. Now what we're going to ask you to do is we're going to elevate your arm. And we can just get you to hold that in your hand. We're going to keep your arm up. So we're going to elevate your arm for approximately 5 minutes. And we're going to time that. And what that's actually doing is the elevation and the pressure over that actual finger is going to reduce the size of the finger, displacing that fluid, shrinking the size of the finger to allow that ring to come off intact.
Okay.
So the only time that we don't want to use this is if there's a crush injury or a fracture to the finger. We don't want to cause further pain or injury to the patient. But if you actually have somebody, like I said, with the arthritic joint, we want to actually decrease that size, which will make the cutting easier. You can still use our device. Anybody that has a fluid retention issue, pregnancy, traveling. I was in New Orleans last week. People were coming down to sea level, eating the yummy food there, and all of a sudden they were ballooning up. They're coming in, you know, after spending a night on Bourbon Street, all puffed up, right? And we were taking the rings off the whole time at the show for them. So this aids in that. You know, you think about destruction of sentimental value, financial value to these products. The damage that the string technique does to tissues, the point load forces on the skin. You cut the ring, you have the sharp edges, you cut the patient, the increased trauma and discomfort there as well. This is all that you're going to feel. Do you have any discomfort with that right now? No. So you'll notice the discoloration of the fingertip. It's completely normal and safe. It's just a tourniquet effect from the pressure that we're doing. It's only 300 millimeters of mercury, and it's only for 5 minutes. Anytime that we do any repairs to fingers or lacerations, plastic surgery, the tourniquet's at a much greater force, and it's a longer period of time.
Yeah, that's spread out.
Yeah, absolutely. So other things that we want to actually focus on is how edematous the finger is. If it's really swollen, we want to keep an eye on our gauge. And if you actually notice, the gauge for you has actually gone down a little bit.
Yeah, I actually felt it.
Yeah, absolutely. And what happens is, think of it as an IV bag. If you put a pressure bag on an IV solution and you pump it up, as the fluid runs out of the bag, the actual pressure will dissipate in that bag. So we actually have to pump it back up again. So if you think of other common airway lubricants that we use in the emergency departments and stuff, they're water soluble and they actually hydrate tissue, so they actually increase the swelling of the tissue, which makes it more complicated to get the device off. So this is safe for use on skin. It doesn't get absorbed. It's very greasy type of a solution, which makes it easier to get that ring off. Then there's the actual technique of taking the ring off, which is what we'll go over when that time comes, when we deflate that. We actually want to rotate, we want to do a little bit of rockering, sometimes some counter traction, and we want to actually slide that off into the finger, because you'll have a little bit of skin buildup because we're deflating the fluid, but that extra skin's there. So if we just pull, it's not going to come off. So we just give it time to work it over that skin so that...
So that's some of it actually, is the technique of actually getting it off.
100%. Yeah, absolutely. What I'm going to do right now is I'm going to put this glove on. And the reason I'm putting this glove on is that this glove... and it has a little bit of a textured fingertip to it. So what this actually will allow me to do is to grab your ring, because you have a smooth band. The rings that actually have material on them that we can grab a hold of, it's not a problem. But these gloves allow us to actually grab the ring itself when there's a smooth texture.
With the lubricant.
When the lubricant's on it, it's actually very hard to actually grab it to move it.
Yeah, thank you.
Yeah, so what we'll do is we'll lay your hand here. I'll stand over this way so we can see. We'll lay your hand down on the towel.
Are you ready?
Let's see how we do here.
So we'll lay it down on the towel. We're going to deflate. We're going to slide this off. So you can notice that you're noticeably smaller.
Right.
So now when we actually apply the lubricant to the ring itself, the first thing that we do before anything else is move the ring and get that lubricant underneath, so you can feel how easy that moves now.
Right.
So I'm just going to take your ring, your hand, nice and loose here, just kind of give a little bit of a bend to the finger. And now what I'm doing is, as I'm sliding this off, I'm just going to put a little bit of traction, some counter traction, and as I'm twisting, I'm just giving that skin a little bit of time to roll underneath. So all that skin is there, and if I just pull, it's not going to come off. So I'm just giving it time. I'm working it down. You can see that we're already starting progress here, because of that actual little bit of tenting of the skin. So we're just going to put a little bit of counter traction to allow that to roll underneath. As I'm pulling, I'm just putting a little bit more force each time as I'm twisting, allowing that skin time to roll underneath. And I just keep pressure, keep rockering it back and forth, a little bit of the counter traction as I'm pulling back. And I just take my time. If you do anything fast like this, it's not going to work for you. It's all about time, slow and steady, working it over the tissues, and you could probably feel it slowly going.
Yep.
And we're at the point now where it's like we're going to make a bet because it's coming off. I could feel it. It's coming off.
Okay, Rebecca. Okay. It's actually going to come off. First time in 44 years, it's going to actually come off.
And Rebecca, you can put it back on. I'm not. So we just keep going with the traction. We're allowing that to work over the skin.
It's funny. 44 years. Never happened before.
Did you notice your finger looks smaller?
Oh yeah. A lot of it is a technique.
It is, right? And it's a little bit of that counter traction, and it's just getting that skin fold over, and we're there now. That's it. There you go.
Look at that.
There you go.
With this ring, I still thee wed. Okay? But
We're just going to resize it before we put it back on, right?
first time in 44 years. And we didn't have to cut it.
There you go. Yeah.
That is crazy.
Thanks for coming by.
Oh, absolutely. Thank you.
You're welcome.